So first of all, thank you very much for having me over. It will be a pleasure to explain how we see RFID transforming the whole healthcare industry as such in the upcoming future. I will be explaining the trends we see in the pharma and healthcare industry. We'll be explaining about NFC. We'll show a few UHF use cases, and I will tell you what Avery Dennison's vision is for this specific key vertical. So, as a vision of Avery Dennison is really that we see every physical item needs to have a digital twin. Every item in the value chain will have a digital identity. And we are very committed to make sure that happens. We like to work with end users like yourself to enable that reality. So what we do at Avery Dennison is really drive adoption in all these different strategic verticals, and pharma and healthcare being one of the biggest actually at the moment for that. And what we see that RFID tags, inlays, are just a small part of digital identification technologies as such. So we really drive adoption together with our partners, together with the end users, and we really focus on having a full solution for enabling authentication of your medical parts, for providing the full tracking and tracing throughout the whole supply chain. And last but not least, also enable customer engagement. So a lot of big brands really would like to have last mile connectivity with the patients. And that is what NFC can deliver. And that is really what gets us out of bed every single morning, creating digital connectivity for physical products and making sure we enable the future of digital twins. And as Avery Dennison, we were there in the beginning of automatic identification. When it all started 25, 30 years ago with barcode labeling, so we know how to be compliant in the pharma and healthcare industry. We know about the right adhesives. We know which face stock to use for specific applications in cold storage. Can be for high heat applications. And now we find ourselves in the phase of UHF, NFC usage, where we will continue to invest in new innovative technologies. And there you can think about printed electronics, print, UHF, NFC directly on packaging. Think about future technologies like Wireless, which is also represented here today. Tiny batteryless computers that actually harvest energy from all the ambient radio waves around you. And with that, actually creating ability to add additional data. It's not only about uniquely identifying items, you also want to capture sensor data more and more. And that is why we as Avery Dennison have invested so dramatically in companies like Wireless. And all these things are not really science fiction anymore. It's already there. It's going to be the future of IoT connectivity. And with that, I would like to show you a video of all the different use cases we see with RFID in the pharma and healthcare, because it will be huge.
Now more than ever, we need certainty, accuracy, and safety. In a world of mass data and information, Avery Dennison has done just this. RFID and NFC technologies in pharmaceutical and healthcare industries help to provide better tracking and tracing, enhance inventory accuracy, improve asset management, and authenticate products. All of this prioritizes patient safety, health, and well-being. With RFID, we can create smarter supply chains, tagging medicine from the start, tracking it through distribution, ensuring inventory is accurate and authentic, and giving brands confidence it will be delivered to the right location on time. Ensuring pharmacies and hospitals have kits with the correct items at the correct temperature. And patients can be easily connected too, from the comfort of their own homes. With custom notifications detailing everything they need to know about their items, being able to track and trace products with full visibility, knowing when the delivery has been sent, in transit, or nearly at your door, reassuring you every step of the way. without diversion, and delivered with efficiency and speed. Once in a hospital or pharmacy, inventory management and quick scanning ensures accurate product allocation, which reduces human error and drastically improves efficiency, allowing caregivers to focus on those that need them most, their patients. The insight provided by patient connectivity not only informs patients, but also helps suppliers gain better market understanding, meaning tracking is made easier and forecasting is more accurate. As the world's largest RFID partner, Avery Dennison helps bring the transformative power of digital ID technologies to the healthcare industry. Get in touch to speak to our experts.
Yeah, so this video basically shows it all, all the different key target applications that can be enabled in the healthcare industry with RFID, where we see a clear split between UHF technology and NFC, where UHF is more focused on the supply chain transparency, whereas NFC is more focused on customer interaction. And think of e-leaflets, for example. What are some market trends in the whole healthcare industry, which we've seen the last couple of years, but we will actually see more in the upcoming years? We see 4 more main challenges, trends. One of them is actually patients are connected. All the patients are connected nowadays, so they are more empowered. So they know more about possible diseases they have, so they're more demanding. Another thing is that we see a whole shift from therapy to prevention. We all know how hard it is to find hands on the bed, to find nurses in hospitals. So there's a really cost pressure on the whole healthcare system, especially in EMEA. So we need to make sure that we prevent people ending up in the hospital. So you see a lot of people doing home care themselves, and that means that you will see a lot of endpoint devices. You will see a lot of patients having blood glucose meters at home. Healthcare systems that need to be enabled at home, need to be digitized. And there actually NFC is a great solution, because with NFC you can make and create that digital connectivity. Yeah, and last but not least, we see a huge increase in counterfeit drugs. I always say you can better do counterfeit drugs than sell cocaine nowadays. It's not a joke. If you see how much money is involved with counterfeit drugs, it's a huge concern for these big brands, and it's a constant changing phenomenon. And what we see is that using a standard 2D data matrix is nice, but with all the capabilities that especially NFC has, with all the high level of authentication, the high security level, it's way better solution for these big brands. And these big brands are scared. They're scared of brand reputation. And they just want to make sure that no fake products land up in the supply chain. Yeah, let's do a deep dive in counterfeit drugs, because it's a huge concern for all of these big brands. There's an estimate that around about 10% of globally sold medication is fake. Think of that. That's what I was saying. This is a huge industry. And actually, if you then take a look at how many deaths are caused by a fake medication, it ranges from 100,000 to 1 million people globally. So that's also a big concern to these big pharma brands. And these big pharma brands, they want to make sure that only their own products go through the value chain as intended, and no other products. And what we see is that when they integrate RFID into the packaging, all of a sudden they get visibility of the value chain. They get visibility of where the product lands up to the patient level. And you can also act very quickly on diversion. Sometimes they see products landing in regions where different commercial conditions are in place in the country that where it's supposed to land. And all of a sudden, this real-time insight in the value chain is so valuable for these big brands. It's amazing. And also, a huge advantage for these big brands is that with NFC technology, all of a sudden, you can interact with the patients. You can interact with the last mile, which always was a dream, actually, for these big brands. What are some trends we see when using NFC in the pharma and healthcare sector. To kick it off, product authentication, anti-counterfeiting I was just referring to, that's a big increased market for us nowadays. We see a lot of authentication issues in the market, and NFC is a perfect solution for that. Why? Because NFC is very highly secured. It's using methods which are also used for payment applications. And so there is cryptographic technology that already exists out there, which is already a proven solution. And what's also key, that it's very easy to use. So with a simply tap of your phone, and having a phone IoT enabled, you all of a sudden can enable different actors in the value chain to do your verification for you. So it's not even up to the consumer itself. It can only be also be different actors in the value chain, reading medical packaging, reading medical implants, and by that ensuring that only the right products travel through the value chain as it is intended. So what we always say, that fighting this counterfeit is not about only protecting the patient's safety, but it's also obviously protecting the brand. They are very concerned that their reputation is safe, reputation is not effective, and that this grey market that they see upcoming is a thing of the past. Because when you have real-time data, you can act on the spot and handle diversion immediately. And then the fun starts with RFID. You can add an electronic signal by adding a tamper loop to your NFC. So you can see on the spot if packaging has been opened or not. And what we see happening a lot at the moment, that brand owners actually enlist everybody they work with in the value chain. So they can even include the distributors where the goods flow through. They all of a sudden like to use NFC technology because there's no big investment for infrastructure. Everybody has a phone. So it's very easy to do. And now we see that not only the patients itself are using it, but also the other actors in the value chain start using it because it's so damn easy. I think there are 8 billion handsets, mobile handsets all over the world. And when you then also add this tamper electronic signal, then immediately spot on, you can react when you see a package has been opened somewhere in your value chain and act upon it. And that's the power of RFID, which no other technology has. And then, of course, you can customize the messaging up to the patient, depending on the opening status of this NFC tag. And this is a trend we picked up, I think, this year. There's a great new technology coming from NXP, where you can actually add sensor technology way more easy with NFC. And one of the targeted applications is detecting fill level. So think about using your phone to see how much material you have left in your syringe, how much fluid do you have left in your syringe. Actually, you can think about automated reordering of this. But also, these big brands knowing what the usage is, or even doctors seeing if you're adhering to your therapy or not. As I mentioned earlier, this remote monitoring is a key future application. And think of wound care products, where with a tap of a phone, you can see if your wound is healing as it's supposed to heal. And even better, now it's IoT connected, you can actually upload this to your patient file. So a doctor doesn't need to come to your home to check it out. A nurse doesn't need to come to your home to see how you're doing. You can actually do this in a remote way. Another very interesting application with NFC condition and sensing is smart diapers. We see the population aging over and over again, and there's a huge pressure on all these healthcare facilities in the elderly care. So it's more important than ever to spend the people we do have on the care, on the elderly care. And up to 60% of all the labor is spent on incontinency management, which you want to avoid. You want to make sure that people spend time on the patient, on the dignity. if you would have a solution that can easily read out if a diaper needs to be changed or not, then you only spend time when needed. And yeah, actually on the upcoming Medica, we will have the first prototypes that will enable this. And there's also another trend we see, home injector units. Yeah, also there we see that these are more and more IoT enabled. Think of injection pens with already integrated NFC readers. So then actually automatically is detected if the right medication is used, but also is the expiry date okay to use. Yeah, and then of course you can also think about uploading the usage to your patient file online. And what we see many times that nowadays also these pens are Bluetooth connected. So you have built-in NFC readers that check authenticity of the consumable used. Very important for the brands because that's where the cost model is very much focused on. And then it's all connected in one device. So those are a few key target applications we've been selling and been working on with NFC technology. But we also see an increasing demand of UHF technology in the pharma and healthcare. Let's have a look at some customer success stories there. And Hanmi Pharmaceutical is actually one of the oldest, most well-known customers we can speak about using UHF technology. Already in 2009, they started using UHF technology to have a fully automated warehouse. They started putting UHF labels on all their medication, up to 60 million a year, but only actually to automate easy picking, easy checking of content of boxes. And this was all focused on having an automated warehouse without any manual intervention. And what they did is basically put an RFID tag, a UH tag on the box. All the items, all the pharmaceutical goods are tagged with UHF tags. There are conveyor belts all over the place. There's a UHF tunnel reader and it checks if the content is what it's supposed to be in the box. So yeah, all of a sudden they had a fully automated process that checked 100% if the order was correct before it was dispatched. But then, and that's so fun about this project, and what we see more and more happening, that once they had the whole RFID tag, they thought, well, we're shipping this all to the pharmacies, we're shipping this all to the stores. So why not send handheld readers out to that? And what they now see is that local pharmacies, so the store employees themselves, are started using RFID for easy inventory management. But also the representatives from Hanmi themselves went out, did easy inventory management based upon UHF readers. And what they saw actually that UHF RFID technology, of course, it fully automated the warehouse process, which already had a huge benefit, and the ROI was within 18 months already. But then all of a sudden, besides the increased efficiency of the shipping process and being able to reduce shipment errors, they also had improved inventory visibility. Yeah, because this is all real-time connected to the system. So also the customer service went up dramatically, yeah? Because they already could do easy replenishment because they knew what was in stock. And because they knew that, you can also improve patient safety. Because when you have real-time visibility, you know which items are close to expiry date, you know what you are selling, you can prevent fake medication coming into that, which gets back to my previous slides, that it's a big concern of these big brands. Yeah, and last but not least, accurate forecast product demands. All of a sudden, they had huge data available. Yeah, and they always did forecasting based upon the year before or the years before. And now they actually could see the visibility of the sales per region, per product exactly. And with that, they were way better equipped to do automatic replenishments. Yeah, another very big user of our UHF tag is KitCheck. I think they are our biggest partners, it's fair to say that, where we do full visibility of pharma from producer up to the hospital. So we work together with them to tag medication already at the start, already at production. All about enabling patient safety, but also to create upstream visibility for these brand owners, but downstream visibility for the hospitals. So how does it work at hospital level? Because this system is already installed, in the meantime, over 600 hospitals in North America. They have medical kits in all these US hospitals, full of medication, and many times it's shipped out and it goes out to an ambulance or an operation room, but when it's then returned in a pharmacy, in the past there was a cumbersome labor-intensive process to check. Is the correct medication still in? Is it close to expiry date? And what they now do, with all the items being tagged, they put it into a smart closet, and within 5 seconds there's a full read, and you can see exactly which items are close to expiry date, which needs to be replaced, which items are missing, and actually sometimes they notice that there are some items in there that should not be in there, so they pick them out. And a very painful process taking up 30 minutes in the past is now a thing of only 3 minutes. So you can imagine return on investment of this kind of technology is great. A very interesting, totally other different use case is with Medline Surgical. Together with one of our best partners, Dipole in Spain, we came up with a solution for Medline, where Medline equipped every surgical kit with a UHF tag. So it now contains all the data, the lot number, the expiration date, and it's all focused on consignment stock management. Hospitals want to know what they have in stock, instead of just guessing. And what is great about this solution, and I'll show a video, is that it's a total hands-free solution. All the nurses could continue to do what they were that they were doing in the past. No barcode reading, no manual counting anymore. Just placing overhead readers, entrance and exits of logistic parts of the warehouse of the hospital, and it's fully automated. And what they see is that it's very easy now to do proper inventory management because you have this real-time visibility of your consignment stock. The purchasing is way more efficient because they already know what they need to purchase instead of waiting till the end of the week or till the end of the month to do an inventory management. It's not needed. Push of a button, you'll see it. And of course, time saving. And nurses can do what they need to do. They can pick out, they can actually replenish. The system is actually feeding this. And I'll show you how it works because it's actually very easy and it shows the big benefit of using RFID.
Medline is dedicated to improving efficiency and accuracy in the operating theatre and is proud to introduce the innovative concept of RFID technology for sterile procedure trays. RFID stands for Radio Frequency Identification. The RFID tag applied to each surgical pack contains an antenna that transmits a signal with a unique ID to identify the specific pack being used. The item number, lot number, and expiration date are also transmitted in the same signal. A reader that is placed at the entrance of your storeroom picks up this signal and keeps track of inbound and outbound pack movements, giving you real-time inventory control. This reliable procedure tray consumption information is connected to MedStock, Medline's on-site inventory management system, for automatic replenishment and consumption reporting. RFID technology offers you 3 main benefits. 1. Inventory tracking. 2. Efficient purchasing. 3. Time savings. With a highly accurate and real-time stock overview of every product in your facility, RFID makes inventory tracking simple and reliable. Combined with MedStock, this technology also makes reordering new surgical packs more efficient. You can create automatic replenishment orders in one step, based on actual inventory levels and self-defined reorder points. But most of all, RFID helps you save time. No more manual counting of stock or scanning barcodes. With this hands-free solution, all inventory is counted and monitored automatically, which gives you more time where it matters most, with your patients. Increased staff satisfaction, up to 15% time savings in surgery preparation, and reduced order processing time and labour costs are just a few of the benefits that RFID technology can bring to your facility. Medline is proud to be one of the first companies to offer this technology for surgical packs, and we look forward to working with you. For more information about our RFID solution, please contact your Medline account manager or visit our website at www.medline.eu.
So what's interesting to see, you see here again, that's all about spending time where it matters the most with your patient. And RFID can actually enable fully automated process for the rest, for consignment stock, for knowing where the goods are, making sure your medication is where it needs to be at the right time, at the right place, at the right patient. And this is just one solution from one company, Medline, for consignment stock. But believe me, there's a whole directive for hospitals also in Europe now that they need to come up with solutions for consignment stock for all the different brands. And that's what we're working hard on, obviously. Yeah, and that's obviously the great thing when we look at what we can supply as Avery Dennison. We know about materials, we know how to make a label work. And many times I get the question, but I already have a pharma label. How do I integrate RFID then? Well, that's not a problem. We know about the label, we know which adhesive to use, we can match actually existing pharma-grade adhesives because we're the supplier. And that's a good thing about working with Avery Dennison there. And we can make, of course, all kind of different sizes available. And you see that RFID can be used in all kind of different form factors to match the application. We have inlays that work well on syringes with fluids inside. Sometimes it can be a flag tag. Sometimes it needs to survive a certain sterilization process. We have the materials available for that. So it's not only about selling inlays, it's selling full solutions to make sure that RFID gets the adoption where we're looking for in the wonderful world of healthcare and medical logistics. So with that, I would like to conclude it. You can scan, actually, and you can connect on LinkedIn, where you will see a lot of white papers. You can find a lot of customer success stories in the pharma and healthcare, because that's really what we like to do. We like to show our success. Where does RFID work? And feel free to connect anytime. Thank you very much for your attention.
Thank you very much. So are there any questions from the audience, first of all? If not, I do have a few questions, if I may. So you mentioned earlier in your presentation there are you can combine sensor technology with the NFC. For example, for the Band-Aid, that would be moisture sensors, correct?
Yeah, at the moment we're focusing on moisture. Yeah.
There are then plans to expand this to other types of sensors? Are there?
Yeah, this is a new technology coming in from NXP, obviously, with NFC technology. So you can do moisture detection, but you can also do fill level detection. And I think that's just the start. We will see more and more sensor capabilities being added to NFC. But be aware that also for UHF technology, there's already a lot of IC technology out there that can also detect moisture, temperature, and of course we have Wiliot upcoming technology. Yeah. But this specific NFC is very much focused now for us on fill level and moisture detection.
Thank you. Then my next question actually would be regarding the RFID tag surgical instruments. I know that some surgical instruments, they can be reused and they have to go through a sterilization process, for example. Are they then repackaged with a new RFID label, or?
Well, it depends. We were just showing you surgical kits, and these are repacked all over again. But if you're talking about surgical instruments themselves, they go into nets, and then they go through an autoclave. There you will have to use ceramic tags, which we also can provide, but that's a hard tag, actually, that we have in our portfolio.
Okay, thank you. That was all my questions. Thanks you very much for your time.
Thank you very much.